statistics global race. Year 2020 started with COVID-19 pandemic. We wanted every single piece of information about this new disease, which first turned into epidemic and then was declared pandemic. As this year 2020 is coming close to its end, it's leaving with a very important question: what about the vaccine? We know there are multiple contenders. In UK, we've seen the distribution has already started. But what about the distribution plan in our own country? Indian government has already rolled out its plan, and today we talk about it in detail for your information. It's FYI. My name is Arun Singh. Let's quickly have a look at the vaccine race. I know you've been hearing about this a lot in the news, or probably you know it already, but just to form a base of our conversation, let's quickly have a look at the vaccine race, and we'll also look at our country. So if we talk about global statistics, global race, there are globally 274 vaccine candidates which are currently there operating. Then we have majority of vaccines which require a 2-dose schedule. Now that is going to increase the challenge of the distribution plan that
Are you somebody who's always dreamt of becoming a coach? But are you somebody who's always continued to help people?
That our government has already rolled out. In India, there are 3 vaccines which are close to authorization. Then vaccines from Pfizer Inc., AstraZeneca, and Bharat Biotech are close to being approved. There are 8 vaccine candidates manufacturing in India scheduled. So that's where we stand when we talk about the vaccine race. But our focus is about the vaccine distribution plan. So if we talk about India's preparation, then there has been constitution of National Expert Group on Vaccine Administration for COVID-19. This group has had multiple meetings as well. And this comes under Ministry of Health. There has been multiple meetings. Now, national and state training of volunteers is also planned to be carried out for a beneficiary or for an efficient distribution of the vaccine. Now, latest electoral roll for elections to be used to identify priority age group. We'll talk about priority age group as well, but latest electoral for Lok Sabha elections and state elections will be used to identify these beneficiaries. Now, digital platform CoWIN has also been created to track beneficiary. So digital platform is created to ensure that everybody in that priority age group is vaccinated at first. There are multiple plans, and now, as I said, let's quickly talk about the priority age group. So first of all, there are a few age groups, and then there are few departments which stand there for the vaccination in its first phase. Now, first is public and private healthcare workers. This include frontline workers, nurses, paramedics, support staff, and even medical students as well, which have been volunteering in this fight against the pandemic. Now, in frontline workers, there's police, home guard, prison staff, and municipal workers as well. Then there are personnel from Ministry of Defense, Ministry of Home Affairs, Ministry of Housing and Urban Affairs, State Police, and as I said, municipal workers. Now let's talk about the age group. Citizens above 50 years of age will be eligible for this first phase of vaccination, and citizens below 50 years of age with comorbidities like diabetes, cancer, hypertension, are also eligible for this first phase of the vaccine distribution in India? That's the biggest question that this year is leaving us with. That what about the vaccine? How it will be distributed for a country like ours with a population of 1.3 billion? It will be a gigantic task. We have our panel as well ready to talk about this. Before we get into that discussion, to get into the details of the distribution plan, let's quickly also talk about the vaccination session that will also form a base of our chat with our panel. If you understand the vaccination session, so 100 people are planned to be vaccinated in one session. So this is written there in the plan that government has launched. Now, number of people per session may go up to 200 if logistics allow, is what the plan says. And then vaccination team will have 5 members, a main officer helped by 4 others, and state or UT can identify specific days for vaccination. So that's the vaccination plan of India. This is the distribution plan. Let's quickly introduce our panel to you. We have Dr. Anita Ramesh, specialist in clinical trials, new drug launch, and works as has worked as principal investigator for more than 20 trials in India. Then we have Dr. Rajendra K. Dhamija, professor and head, Lady Hardinge Medical College, New Delhi, also WHO fellow. We have Dr. Rajiv Seth, senior pediatrician and expert on vaccine. We have Dr. Prasun Chatterjee, associate professor, geriatrics medicines, AIMS. And let's now quickly take our first question to Dr. Anita Ramesh. And Dr. Anita, thanks for joining us. And here we have a vaccine distribution plan in front of us. There are multiple challenges that we have. The first one that I see is challenge of training the staff amid the pandemic. We will require a lot of staff here, but how will their training really be done while we are into the pandemic? Do you think it's possible virtually?
Yes, see, the medical profession has not, and the paramedical teaching has not stopped. Yes, online platform is still available. We can definitely treat all of them in an online platform because modules are available. And one more thing before we proceed to training. In India, we have done very well with the vaccination. Particularly, we have a nice national immunization protocol in place. And vaccination is continuing for a long time in India, and we are quite successful. So the infrastructure is there. But now, with the pandemic, the demand is high and we need to meet the needs. You are very right. In a pandemic, how do we teach them? But online classes, education, CMEs are continuing. We have modules to teach them online. Only the point, those who are actually going to give the vaccine needs hands-on. But then it's a subcutaneous injection, can be given easily. So we do not need that hands-on or in-contact training, but the mass country and people involved in vaccination and distribution can be trained in this module.
Okay, so Dr. Anita rightly mentioned that India has been doing great in its immunization plan. If I give you a stats on that, the health survey 2015-16 says that 62% children are fully immunized at year, so which has been better than previous years. My next question to Dr. Rajiv Seth, most of these vaccines that we have will have a 2-dose schedule. We had a case of Health Minister of Haryana being administered first dose and then he contracted COVID-19. So this actually signaled and conveyed that it's very important to have the second dose as well. And most of these vaccines have this 2-dose schedule. Do you think we'll really have to check the dropout rate for second dose, and how do we do that, doctor?
Absolutely. I think in this kind of a pandemic, the challenge will be not only to give the second dose, booster doses, but also to track. And the tracking ideally can be done by mobile technologies. The Prime Minister has already announced that they will be using technology, and the government is also having a massive drive to look into how to administer and track people getting these vaccinations. So there are systems around. Even our BUTS team in Mammoth had implemented a mobile cellular technology approach, a randomized control trial. The government is aware of other modules. So there are different ways you could not only keep records of these people online as well. because as in smaller communities, many people after the first dose may even lose their cards and may not come. So through a mobile technology which is calling them, they could be getting their vaccinations. Yes, it is true that vaccination coverage has increased in our country, but in the marginalized and the aspirational districts, it's still a challenge. Access to healthcare, access to vaccination is also depends on a lot of social determinants of health. Therefore, it is important that from now on, we need to actually reach out to the communities to let them know about this coming up vaccine drive so they are mentally, emotionally prepared. Already we are seeing rumors around, and that should be actually, and they're also fake news. I think these vaccinations are very important to save lives. But it's also important at the same time to understand that you need to immunize at least 30 to 50% of your population in order to develop the herd immunity, that is immunity for the whole country, and it's only after that you will expect the pandemic will go away. And therefore, it's very important while these vaccination drives will start pretty soon, we need to continue our social distancing, mask, and other personal hygiene and safety precautions for COVID.
When you finally perfect your data objects, storing, retrieving, constructing, and deconstructing them can be a cumbersome drain on both productivity and performance. With MongoDB's native document data model, your objects are efficiently stored in JSON format, structured just as they are in application space. MongoDB Atlas takes the pain out of storing, securing, and growing your data in the cloud so you can focus on solving bigger problems. MongoDB Atlas. Try it for free.
Do you want to start your own business with these three advantages? Number one, you don't have to leave what you are doing right now. Doesn't matter whether you are in job or in entrepreneurship journey. Doesn't matter. Do what.
Yeah, so one thing that one has to keep in mind is that even after the first shot is administered to the first group, it's not that pandemic is going to get over. Taking cue from this point, I'll also take my next question to Dr. Rajinder K. Dhamija here. So we also spoke about, rumors. How do we build confidence amongst citizens? We've seen in Western countries how people have been campaigning against getting administered a vaccine because they say the mortality rate of this disease is not that high. So how do we build that confidence here in our country?
Thank you very much for having me in the show. We have been racing, all of the world has been racing against time to get the vaccine. And now the vaccine is around the corner. So Arun, there are 3 or 4 steps in vaccination to combat COVID-19. So first is to have the vaccine identified and get it approved, which is now happening in a short weeks from now, a few weeks from now. The second is prioritization, which we have already been seeing that the government has a blueprint, and the priority is for the health workers who have to run the hospitals to look after the sick patients suffering from COVID. And the third is, of course, logistics, which you talked about. And now coming to the awareness and the vaccine, anti-vaccine campaigns and things like that, which is happening. So fortunately, in our country, it's not a big problem. We are all waiting for the vaccine. But yes, in Western countries, the survey shows that 40 to 50% of the people may not be keen to have the vaccine because of the hurried way the vaccines are being approved. It's not the hurried way. It's absolutely the vaccines have gone through the rigorous scientific protocols, and it has been approved after due diligence. And it's a very important thing that no shortcuts have been done. So we have to make the people convinced, make the people aware that the only way to combat this pandemic, to control this pandemic, is to vaccinate, as previously speaker telling, the maximum number, the majority of the people getting vaccination to get a herd immunity and to control the pandemic. The pandemic is going away only with the vaccination. That's possible with the majority of the people getting vaccine. That's number one. So role of media and role of the public campaign, which is government has started from today to make people aware, to make public aware about the benefit of vaccination and why it is important to get the vaccination for all of us, whosoever is in the priority list of the government. So role of media is very important, and the government has opened up all the channels to make the people, aware of the vaccination campaign.
Right. So, Prime Minister Narendra Modi, in his multiple addresses, he's also pointed that how it is very important for this vaccine to reach that block level. And of course, we have multiple health workers working there as well. My next question to Dr. Prasun Chatterjee here. We have around 28,932 available cold chain points in India. That's the Health Ministry's data. Do you think that's enough? And also because it will also include the transportation part as well, for these vaccines to reach the block level. How difficult is that going to be? And also, what about this number that I just quoted, 28,932 cold chain points? Do you think it's sufficient?
See, it is a very pertinent question at this juncture. But as government is planning to give, first they are going to stratify who are the highest risk group. So we are not giving together. Everyone is not getting together. So once we stratify that way, so first healthcare worker, then elderly people, multimorbidity. So point is. What number will be adequate, that only time will say. But as we are going as in a stepwise manner, so I think it is possible to reach out to everyone. And as a geriatrician, I will say especially elderly people who are the vulnerable group, reaching out to them, there the family member, care provider will play a major role. They have to, because even I was seeing through this online portal, there you should register. Most of the elderly people are not that digitally savvy, especially if I go to tier 2, tier 3 or rural India. So their young generation caregiver, family member has to take part in this project, and they should proactively register, contact how to get the vaccine, because this is so important. And as my previous speaker rightly mentioned, we have to promote this. We have to go against this campaign that you should not vaccinate. Vaccine can create some side effect, of course, but everybody has to work together for this.
Yes.
Of course, it's going to be a big task here. My next question to Dr.
Quality has a name, and that name is Kisco. Since 1993, we've been committed ourselves to
Dr. Anita Ramesh here. It's not as simple as administering polio drops where you just go door to door and administer it. It is going to require a whole lot of infrastructure and also some safety guidelines as well. So do you think, as far as the safety is concerned here at this point, do you think what kind of measures do we really need at block level, at district level or state level to administer a vaccine, considering the safety of the entire process?
See, if you talk about safety, which is our prime most important thing at this point of time, human safety, and first the vaccines has to be approved by the DCGI, that's the Drug Controller of India, to get people vaccinated. That is on the process and it's yet to come. Second, once the vaccine gets approved, yes, there is a whole setup by which the vaccine has to be administered. One is that it is a 30-minute process. All over the world, people are trying to see that at one particular center, we'll try to vaccinate only 100 people. So the person comes in, we have a digital record, we look for his comorbidity, we look for his allergy, then the healthcare worker takes to the next room and the vaccination process takes place after consenting. Then the person is asked to sit in the third room where he is kept for observation for the next 30 minutes. So we cannot rush, because that last amount of time is needed for us to observe that whether he is getting any acute reaction at that point of time. So the whole process approximately takes place 30 minutes. It is devised in the West. We are trying to do it in India, and that's how to assure that you are safe, and when you leave the center after the end of vaccination, you walk out of the center without much problem. So this takes time. Not more than 100 people can. Not more than 100 people can.
The government guidelines actually talks of this half an hour period in their operational guidelines. Now, this is a short-term, or let's say the immediate effect that we'll be seeing. But Dr. Rajiv, what about the long-term impacts of it? How do we track that? Because once the vaccine is approved, and there are going to be multiple vaccines here. So how do we study the impact, or let's say long-term impact after 3 months, 6 months? Do you see it as another big challenge? Of course, we have these guidelines to get the vaccine administered. But do you think it will need another set of guidelines to see the after effects?
I think we need to be patient here, and we need to take one thing at a time. When the government and the drug controller of India is going to launch these vaccines, all the safety measures, all the efficacy would be studied. And after the vaccine uptake is occurring in the community, the government and the agencies are going to track the effectiveness of this vaccine beyond administration times. So it is going to take a time. The pandemic is just less than 1 year, and it has taken such a heavy toll of lives, more than 98 millions of people in our country, 1.4 lakhs death. So the priority is to give this vaccine, and what we all need as medical and health providers and the media, everybody, all agencies need to encourage vaccine acceptance and to training our frontline health workers. You see, what we're talking of, the administration of vaccine in remote villages, that is done by the ANMs, auxiliary nurse midwife, and the ASHA workers and the Anganwadi workers. These community health workers, we need to build their capacity so that their vaccine acceptance increases. Recently, the Buds, our non-profit, had done a research on focus group discussions, small focus groups with different partners like mothers, pregnant mothers, mothers-in-law, fathers and men, village panchayats, sarpanch elders, and religious leaders. These people have a big role to play, because if they say no, then whatever you may try, the vaccine is available. Even today, the vaccine program, like you mentioned, covers only 60%. Why not 98%? Like the West? Because there are a lot of social determinants of health. There are lots of rumors and negativities. They have to be suppressed, and a training and capacity building of everybody involved in the vaccination drives is very important. Obviously, the children are the most important, and I think in this issue we need to realize that after the frontline health workers and elders and people with comorbidities, even children will need vaccinations, because children are super spreaders of the disease. They remain asymptomatic 70% of the time. So we need to target our high-risk populations immediately while we try to achieve immunization to achieve herd immunity levels when 30 to 50% of the population.
Ministry of Health is on its website is also inviting some volunteers also to get onto this task. Dr. Dhamija, what do you think is the kind of training that would be required? I mean, of course, there are going to be multiple kind of workers that will be seek their help for. But what kind of training do you think is required for this vaccine distribution plan specifically?
Look, this pandemic is only won by the community participation and volunteering. So it's just not one part of the society or one part of the administration of the government or the researchers or the scientists or the doctors. So we have to all collaborate and work together to fight this pandemic. And that is why the ministry is also inviting people to come forward and participate in this for a battle against the pandemic. So more and more volunteers would be required. Of course, as you said, it's a mammoth task, and even the people in US are also finding it difficult to manage this logistically as well as administration. So the training of volunteers can be done at the level of block levels or at the level of subdivision levels, and the backbone of this whole campaign would be the primary health centers or the centers where the people would assemble in stagger way and get the vaccine. So the training, of course, will involve the sanitization, the distancing, and the all other public health measures for the people around and for the injectors. And then comes the community health workers who would actually inject the vaccine to the people.
Hi. Are you someone who's always aspired to become a speaker, trainer, coach? Are you one amongst...
Okay, next question to Dr. Chatterjee here. We have multiple... Go ahead.
May I add that this is in a small time, we are trying to immunize 1.3 billion of our population. So that is where the challenge is. And therefore, what the Prime Minister has said is absolutely right, that we need to look at technology. I think we need to develop cloud-based platforms, maybe even biometric linked. so that we have a software platform which can actually, track who's got the vaccinations, and subsequently mobiles approach where we could call these people, and local partners and local staff, the frontline health staff, which is already doing a super jobs, I would say, given our limitations. The ANMs, the Anganwadi workers, and the ASHA workers, they need to be encouraged. It is we have platforms. An Indian software company, RDPL, created a platform for us about 3 years ago. The Ministry of Health is aware of that, in collaboration with Johns Hopkins University, the BUDS program. So there are other programs as well, where through a software you can track who's got the vaccinations. You can actually, sitting in your offices, can actually track which community has not been immunized. And so this will be a cloud-based, and therefore technology, which India is a leader in internet technology. And today internet is available in the remotest part of the country. So tracking will be very important. And I think we have technology, we have support, and if we have the mission that government has today, we can succeed in this approach.
Oh, okay. Dr. Chatterjee, one last question. If we are talking about two-dose schedule, just to wrap up the conversation, we're talking about two-dose schedule here. And of course, that digital infrastructure will make sure that whosoever is administered one kind of vaccination gets the second shot of the same. But another question is, can one, or let's say, can a citizen go for second kind of vaccine after a year or after a certain period of time, or will it be as advisable?
At present, the answer, if I say one-line answer, I'll say no, because you are giving the second dose to boost your immune system. First, because you have to understand it works with both humoral as well as cellular immune system. Especially for the vulnerable group, why we are giving two doses, because first dose may not create adequate antibody response in your body, especially those who are vulnerable, elderly people, multimorbid people, those who are immunocompromised people. So for that reason, we are giving the second dose. So second dose should be preferably the similar same vaccine whatever you have given. Even the discussion is going on, and maybe we need some further trial and research on that whether they need third dose also or not, especially those are not mounting immune system adequately. Regarding, I just want to continue, because we have to give stress maximum on whatever existing system we have to utilize. Definitely we will go on digital things and all these things, whatever my previous speaker mentioned, but we have a very good, already we have an existing system. We have to use the system. It is not that the first time we are immunizing people. We have done repeated immunization, and still it is going on. Right.
Thank you so very much. With this, I would like to thank our panel here. What a great conversation this has been. So we, of course, spoke about the vaccine distribution plan. It's a big plan, but that doesn't end our worries immediately. It's a long plan, and multiple sessions of it are required. My name is Arun Singh. This is a goodbye from my side. This was FYI.
When you finally perfect your data objects, storing, retrieving, constructing, and deconstructing them can be a